when you could, be outside playing Frisbee. You're here with us, so that's wonderful. Thank you so much for that. This event is hosted by the Center for Career and Experiential Education. My name is Val Trainer, and I am an advisor here at URI. I work for University College, and I advise for the College of Health Sciences. So just want to let you know this panel will be recorded, but I would love to start out by asking each panelist to just introduce themselves, pronouns if you choose, and what your current position title is. So could we start with Heidi?
Sure. Hi, thanks for having me. Sorry, my camera just glitched for a second. So my name's Heidi Weidel. I graduated in 2017, and I'm currently the lead fatal overdose epidemiologist at the Rhode Island Department of Health.
Awesome. Allison.
Hi, my name is Allison Hanley. I graduated from URI in 2015, and I am currently a genetic counselor.
Great. Let's see here. Do we have Maya? Maya, are you there?
Hi, sorry, I'm here.
Okay.
I graduated from URI in 2017, and I'm currently working as a registered nurse.
Kelsey.
Hi, my name is Kelsey Porter. I graduated from URI in 2017 as well, and I'm currently the Director of System Operations at Hartford Healthcare in Connecticut.
Great. And last but not least, Kerwin, are you with us?
I don't believe he's able to join today.
Okay, very good. So I want to thank all of our panelists in advance for taking this time to be with us. Recent graduates who were not long ago were sitting right where you're sitting. But I wanted to just start with all of our panelists, and we can do the same order. Heidi, if you want to start, tell us about your career journey after graduation, after you finish URI. What position did you start your career in, and how did you enter into the role you're in now?
Yeah, so that's a great question. So immediately after graduating from URI, I went on to get my master's in public health at Brown University. So I was between Boston University and Brown University, and for people who are like currently looking, those are, you've got a lot of really good options if that's the path you want to go. Those were the ones I was looking at. So I concentrated in epidemiology and infectious disease. Immediately after graduation, I had actually applied and gotten a fellowship with the CDC in their infectious disease division, moved down there, and then due to life circumstances, actually came back to Rhode Island and started working at the Rhode Island Department of Health in February of 2020 as their PDMP epidemiologist. So I worked with prescription drug data. Obviously, then 2020 happened. I got activated for their COVID response team, which was a lot, but very, very cool experience. When I got deactivated, my role switched a little bit. I started tracking naloxone distribution in Rhode Island. And then more recently in, 2022, so last January, I switched roles and became a fatal overdose epidemiologist on the same team. And then starting in August of last year, July or August, I became the lead fatal overdose epidemiologist. So that's what I'm doing now. So it's been a little bit of a journey and not a very long time, but it's been very cool.
I was going to say February 2020 is an interesting time to start at the Department of Health.
Yes, and it was right. Yeah, crazy time, but definitely a good time to be, a good time and a bad time to be an epidemiologist, I think.
Great. I just wanted to interject for those of you in the audience. If anybody has, an immediate question they want to ask, if they want to type it in the chat, I'm also going to be moderating that. But we are going to have a chance at the end of this session for Q&A anyway. So I just wanted to throw that out there. Okay, who's next?
And I think I was next. So
thank you. Great.
when I graduated in 2015, I graduated with a health studies degree and a biology degree. And I didn't have a job. So I really didn't know exactly what I wanted to use those degrees for. I felt kind of like frantic in the search to find a job. I was applying to a lot of jobs, just, that I thought would be a fit with my degree. And I ended up at a biotech company on Long Island. And I started as like a tech support specialist, basically answering questions about the biotech company's products for researchers. That was a little bit technical for me. I survived that and somehow made it onto the sales team, where I was then traveling, speaking with customers, working to sell the biotech company's equipment and tools. Realized I really enjoyed talking to researchers, talking to people, selling the product, but the sales aspect really was not a perfect fit. I'm not super pushy. In sales, you kind of have to have that drive. So while I was with the biotech company, I was thinking about, what would be a better fit for me. And I was also volunteering as like a crisis counselor along the same time. So like the experience of speaking with people and then doing some counseling and volunteer work, I kind of stumbled upon genetic counseling, which is, both that science, needing that science knowledge, but also counseling skills. I was able to get in with a genetic counselor to shadow them at a maternal fetal medicine clinic, and really felt like it was a good fit. As I think a lot of individuals who are in this health studies degree, they at least kind of how I got into it. And I think I got into it like the year that it started. But, I at first thought maybe I'd want to be a PA or a doctor, but that didn't seem like the perfect fit either. And what I liked about genetic counseling was you get to actually spend a lot of time with the patients. It's not like you go to a doctor and you have 15 minutes and they kind of tell you the testing you're going to get and kind of push you along. You actually have time to explain the full process, the testing with patients. So, and take time to, make sure that they fully understand what's going on, what the testing that they're going to have, the results that they get. So basically it seemed like a good fit. And then I had to apply to graduate school. I did 2 years at the University of Maryland, graduated from Maryland, started as a prenatal genetic counselor at a local hospital in Baltimore. But now I work for a remote genetic counseling company. So we have partners with hospitals, with labs, and we counsel for all different specialties. So I do prenatal and cancer. So basically also a lot to get me where I am now. So basically there's not always one path.
Wow, that's fantastic. Okay. How about you, Maya?
So I actually, when I first started at URI, my declared major was nutrition, and I did it my first semester in freshman year. And I really found it interesting, but I was struggling a lot with the classes, and I wasn't sure like exactly what kind of direction I wanted to take it in. So that's when I started meeting with guidance counselors who recommended the health studies program. And I totally loved it once I transferred over to that. I still was like struggling like throughout my undergrad, trying to figure out like exactly what kind of career I wanted to have. Honestly, like up until I graduated, and kind of like other folks have said, when I graduated, I wasn't exactly sure like what kind of position I wanted to take. So I just applied to a few different, I applied to a variety, and I ended up working as a medical scribe in the ER. And I totally fell in love with it. Like I just fell in love with like medicine and being in an environment like the ER. And I was thinking at first, maybe I wanted to be a PA, but I also was thinking after a while, like maybe it's not quite the right fit for me. So I ended up going back to do an accelerated nursing program at Mass College of Pharmacy in Worcester. So it's a second bachelor's degree that I did in 16 months because of all the prerequisites I had done for my health studies degree. I was able to get it done pretty quick. And now I'm working as a nurse in the ER again, and I totally love it. I think that eventually I will want to become a nurse practitioner, but at this point I want to have like really solid nursing skills before I go back to school to do that. So that's kind of where I'm at right now.
Wow, such interesting paths, all of you. How about Kelsey?
So after I graduated from URI in 2017, I went right to graduate school at George Washington University, getting my master's in health administration, or MHA. And the program at GW is one of 7 or 8 left in the country that is actually 3 years long, because it requires you to complete an administrative fellowship in that 3rd year. Going into grad school, my biggest kind of concern was finishing and then not getting a job. So I really liked the fact that doing that fellowship program, which I had to do to graduate, meant that I was at least going to be employed for 1 year. And fortunately, next month it will be 4 years at the same organization. So I completed my administrative fellowship here at Hartford Healthcare from 2019 to 2020, which was an interesting time to end that fellowship. And then I've stayed with the organization ever since, working in a variety of different roles. Most recently, my current position is the Director of System Operations. So throughout all of it, I've really enjoyed working in hospital operations. During my fellowship, we had actually acquired a new hospital in a different part of the state. So I was really fortunate to be able to work on, how you take this $500 million asset that you just purchased and integrate it into your system of care, how you, really embed yourself in a new community, a new part of the state to make sure that you're meeting the needs of the patients. And it was a really great experience and something that definitely kind of furthered my passion to stay in hospital operations.
That's great. So I have some questions here that I want to ask, and part of the reason for these questions is to sort of get the question asking juices flowing here among students. So students, please feel free to pipe in, or if you want me to anybody to sort of expand on any of the questions I'm asking, please feel free to do that. But I had a question for Heidi. I wanted to know, how has your degree assisted you in the position you're currently in?
Yeah, so that's a great question. So I actually initially did not set out to be an epidemiologist. I knew that I wanted to get my MPH and continue to go on to school. And I kind of just went right through because I knew that if I stopped going to school, I wasn't going to go back. So I kind of went into it with a little bit of a loose expectation and explored like what kind of degrees they had. And then by choosing my concentration, I kind of put myself like looking into roles like mine. So the best advice that I had received from other like people that I've been working with, other friends that were kind of in the field at the time, was to get, when I'm going through school or doing internships or going through jobs, is to build technical skills, because you can always learn content area information, but you can't always pick up those hard skills on a job that you're applying for. So I really chose the epidemiology focus because I wasn't sure if I wanted to go into data analysis, but I knew that if I had chosen more of like a content-based focus, that I wouldn't be forced to get those skills, and I could always like learn some of that later. So going into that program and taking that track really did open up a lot of doors for me, because I wasn't just limited. I guess when I got out of school, all of those other options that required SAS coding or R coding or any sort of data analysis, data cleaning were now open to me, whereas they wouldn't have been beforehand. And I will say anyone who's looking to get into like any sort of data evaluation, biostatistics, whatever, definitely make sure to take at least base level courses like statistics and coding and things like that, or even doing it in your free time. So I think the health studies program at URI kind of gave me the first open door into just seeing how broad public health as a field was. And then I kind of like further narrowed that down, and it gave me those baseline concepts about like equity, project planning, you know, population health in general, sort of all of those things that shaped how I approached my MPH, and then later on how I approached specific positions that I was looking for, if that makes sense.
Yeah. Heidi, can you tell us, maybe sort of give us like a snippet into what a day in the life of an overdose epidemiologist kind of looks like?
Yeah, absolutely. So my day is pretty split up depending on, I guess, a lot of things. So, and I really enjoy that. I don't think that I could do like one specific thing all the time, which is really nice. So currently at work, we're kind of at the end of a grant cycle. We're applying to new grants. So pretty much all of my week this week has been dedicated to grant writing, which I hadn't had previous experience in, and it's a lot. In other seasons, when there's less grant focused work to do, I do a lot of data cleaning and surveillance, a lot of SAS coding, and trying to figure out, you know, what my job really focuses on. Are there trends in fatal overdose data? Are there particular populations in Rhode Island that have an increased burden or disproportionate burden of fatal overdoses? Are there any trends that we're seeing in certain drugs that are contributing to fatal overdose? So right now, fentanyl is a really big one. Xylazine is emerging. And how can we use that information to kind of guide overdose prevention? So are overdoses happening in certain locations? Are people, you know, overdosing when there are bystanders around to call 911? Are people using naloxone? You know, are there certain populations that we should be reaching with different interventions or prevention efforts that we aren't reaching or haven't like been in contact with before? So I kind of follow through the whole process of asking those questions, gathering the data from things like the medical examiner, the forensic toxicology lab, police reports, things like that. I use that information, answer my analysis question, and then I'll usually wrap that up into kind of either a presentation, like a PowerPoint, or a data brief, or you know, even like packets or things like that, depending on who I'm sharing this information with. So you have to kind of be able to communicate to a lot of different audiences, even writing like manuscripts that have gone through for publication, and then kind of moving that on to the next step. So whether it be sharing with other people to do further research, or if I'm giving that to people on the overdose prevention team at the health department, so they can kind of guide their specific interventions that they do. Or even I share that data with community partners, so people in specific cities and towns that have a high burden of overdose, if they have their own like coalitions and things that do things more like boots on the ground work. Let's see, there's a lot, and there's also just a lot of collaboration with other government agencies. So I work with Behavioral Health and Human Services, DCYF, the governor's overdose task force. There's a lot of different people that I have to interact with, which makes it really interesting too, because the way that I communicate and like what I'll be communicating kind of changes based on that. So I think having the public health background and being able to translate more of like the data heavy language into, I guess, whatever it needs to be based on where it's going has been really interesting too. Sorry, I just rambled. Not sure if that answered your question.
Oh, that's great. That was great. Thank you. Yeah. Actually, I have a question for Allison, if you don't mind. Are there any specific skills or work experiences or coursework that can make students more competitive for positions within your field? If you have any advice about internships or volunteer work courses you found to be most beneficial?
Yeah, that's a good question. So a lot of, at least when I was in the interview process for grad school, a lot of the people I was like interviewing with were genetic counseling assistants. So that is a role that it's a paid job that can be done if you're thinking about being a genetic counselor and you want to learn more about the role. There are genetic counseling assistant positions. You basically work with a genetic counselor, you help prep their schedules, with that experience, I'm sure you can shadow. So that's a paid job. If you are thinking about genetic counseling, that's one route. Additionally, doing volunteer work in like the crisis counseling setting is definitely helpful. So I volunteered as a crisis counselor for a few hospitals on Long Island for individuals who were sexually assaulted or in a domestic violence relationship, and would get called to go to the hospital, meet them at the hospital with a forensic nurse who would do a physical exam and take pictures and take samples. And I would be there as like a support system to really talk about the resources that they had to use afterwards, whether it be like creating a safety plan or counselors that would be available for them to help them move forward. So that was a good experience that I think really helped.
It was like learning how to support others.
Yeah.
Okay. Yep.
Exactly. So, that really helped me learn, the tools I needed in just the counseling setting. Those were, sitting with people through extremely challenging times and helping them through it or supporting them through it. As a genetic counselor, I deliver a lot of sad news, whether it be genetic testing results for somebody who has a cancer diagnosis and now they found that was due to a genetic cause. So not only could they be at risk for other cancers, their children or their close blood family members could be at risk as well. So talking them through that. I additionally, in the prenatal setting, would talk to couples right after a bad ultrasound finding or delivering a result over the phone that the baby is high risk for a genetic condition like Down syndrome or more severe conditions that, and they could miscarry or the baby could pass away shortly after birth. So having those difficult situations, even though they're very different during the crisis counseling, helped me build some skills to counsel when delivering some bad news over the phone or in person. So that's another tool. And then just thinking about like coursework, obviously your biology classes were helpful, genetics classes, but I think public speaking was also pretty helpful because I do a lot of speaking, whether it's just one-on-one to patients, group counseling. So those are just skills as well. I think that helped.
So can I ask you, before you became a college student, did you have strong feelings about public speaking?
I still am nervous about public speaking.
Okay.
I had to take a class in high school. I think that helped a bit. And then I purposely put myself in it in college because I feel like unless you kind of force yourself into those situations, you always kind of want to avoid them. But in grad school, you have to do a lot of presentations. So I think having all those experiences prior helped as well.
I was really glad that you brought that up, Allison, because I know that, here as an undergrad, I'd say that probably, about 90% of the students that walk across the stage have taken COM 100 just because, in the end, they kind of have to. But it's, when I work at orientation, and, when you tell a student, COM 100's about, small group communication, public speaking, when they hear that word public speaking, it's like, oh, no, I'm not taking that.
Yeah.
And I think in every profession, well, I mean, especially yours, but probably in every profession, more or less, there's some point where you're going to have to address more than one person. Yeah. So no, it's just really interesting that you said that. I was glad you brought that up. So Allison, can you tell us what the day in the life of a genetic counselor is like?
Yeah. So, it depends on what specialty you're in, but genetic counselors cover all different types of specialties. There's prenatal genetic counselors, cancer genetic counselors, which I kind of touched on, cardiology counselors, pediatrics is really big. So you can work in hospitals. That's where I started out as. I worked in a maternal fetal medicine clinic, and I worked with 2 doctors, a bunch of sonographers and nurses, and would see patients really after their ultrasound. So pregnant couples would come in, they'd have an ultrasound, and then I would talk to them about genetic testing that was available for them. There's definitely routine testing that's offered, for example, in the prenatal setting, in every pregnancy, like screening pregnancies for Down syndrome, screening for conditions called carrier screening conditions to see if couples are carriers of the same condition and could have risks for their offspring. Basically, my role is to just let people know of their options and then help them make an informed decision on if that information would be helpful for them. So it's not like, sometimes it can feel like a car salesman, like giving them all the options, telling them, but it's more so like just letting them know what's available for them so that they can decide if it would be helpful information. It's never something that they have to do, genetic testing. And then also discussing the risks of genetic testing. We could learn something about their health that they might not be aware of. So then, if they do the test, great. If they don't, great. Whatever is their decision. Then I'm responsible for basically calling out all of those results, good news, bad news, and delivering it to them in a way that they can comprehend and kind of discuss, what their next steps are based on that information. So the hospital setting was pretty fast paced. I had a set schedule of patients, but if anything came up on an ultrasound, I'd have to see add-ons. So talk to patients after an ultrasound finding, talk about different testing options for them. Kind of responsible for insurance coverage of testing as well. So you play a lot of roles as a genetic counselor in the hospital setting. After 2 years of that, I transitioned over to a company that has a ton of genetic counselors, whereas at the hospital I was all by myself. Now I work in a large team, and we have partners who are hospitals or labs, and basically I do some pre-test counseling for cancer patients, take their family history, see what testing would be a good fit for them, but it's a lot of calling out results also. So giving results about if a cancer genetic change is identified, talking about kind of the next steps for family testing or what they should be looking out for. And then the prenatal setting, it's reviewing carrier screening results. So talking to couples that are carriers of the same condition, what their risks are for their offspring. I also do a lot of testing that's called PGT testing, which is testing on embryos. And then talking about, the risks to these couples' embryos who are going through IVF, and if there's any genetic changes, the limitations of the testing. So every day it's, something different. I can see up to 12 patients a day. But what's nice about this company is we have genetic counseling assistants who can do a lot of the prep work and all of the background stuff for me. So I just can focus on talking to patients.
Okay. Allison, we had a question here from a student. The student asked, do you need a certificate or some type of education for a genetic counselor assistant?
I don't believe so. Genetic counseling assistant, I think just a bachelor's degree is fine for that position. To be a genetic counselor, you do need to go through and get your master's and take a certification test. But for genetic counseling assistant, just your bachelor's degree, I believe. Truly not even sure though. You may be able to get a position while still in school if you're planning to be a genetic counselor. Could be worth looking into.
Okay, great, Allison. Thank you so much. Wanted to ask Maya a couple questions here. So Maya, I know that you're at the hospital now, and right now in the US, more than 2/3 of job seekers say that they looking for diversity and equity and inclusion as a very important factor in their decision to accept a job offer. Can you tell us a little bit about your specific organization's commitment to those initiatives?
Yeah, sure. It's actually funny you bring this up. So I graduated from my nursing program at the end of 2021. So at this point, I've been a nurse just over a year now, and I'm at Newport Hospital. It's affiliate of Lifespan, and all new grad nurses in at the hospital are automatically enrolled in a new grad residency program where we meet once a month and like discuss specific topics. And the most recent topic was discussing diversity and inclusion. I do think that this is something that's very important in a workplace, and I think that in general it's something that we're all striving to get better at, especially working in the emergency room where we see people from all different walks of life, so to speak, and different cultures and different economic backgrounds. So it's definitely something that I value a lot, and I think it's like a really important for everyone that works in the hospital setting to value, if that makes sense.
Yeah, sure. Great. Now, Maya, when you were speaking earlier, and you were saying like how much you love, being in the ER, it made me laugh because I was in, I don't know if you can see this on the camera. I was in the ER this morning because I liked my finger. But while I was there, I was looking around and thinking, thank God people want to do this for a living, because it just seems, so chaotic. And, but I mean, with that said, I'm sure you probably have days that are better than others. So, could you tell us a little bit about what is the most challenging and what's the most rewarding about your position?
Oh, that's a good question. I think that the most challenging thing is like, it's just such a fast-paced environment, and you want to spend as much time as possible with your patients, and you want to make them feel as comfortable as possible, because obviously if you're coming into the ER, you're not comfortable. And I feel like it's my responsibility as your nurse to make you feel safe and comfortable and try to help you feel better from, whatever's going on. And sometimes I am able to accomplish that, and it's like the best feeling ever. And sometimes I'm not able to accomplish that, and it kind of sucks, but that is just the way that it goes, because not every problem can be solved by just, a Band-Aid. But it's really rewarding when I get to discharge a patient after fixing their problem. And it's really challenging when when I'm faced with hard situations. Like, for example, I could have a patient who's passed away in one room, and then I have a patient in the next room who's there for like, a sprained ankle, and they're like, why haven't I gotten my x-rays yet or whatever? And it's because I was tied up in the other room with a patient who had just passed away. So it can be really hard to balance your patients and balance your emotions and care for yourself. I think that's a huge thing that is really important when you're working in a setting like I do, is that I have to remember to take care of myself. And that definitely takes extra effort.
Now, Maya, has there ever been a situation at work where you felt that your safety was compromised?
Not in my nursing career yet. if a patient were to come in with a stab wound or a gunshot wound or any kind of violence, the hospital itself, like the whole hospital goes on lockdown and no one is allowed to enter, exit the building. And there's like security like surrounding all the entrances and exits. So, and that
I'm sorry, I'm interrupting. I know, is the reason for that because there's not an indication that the violence has ended?
correct, yes.
Oh, okay, all right.
And so in that instance, sure, it can be scary, and it has happened to me as a nurse, but it's never been the case that there's still a threat of violence. It's always been kind of like an isolated incident. And definitely, you know, working in the ER, you have a lot of patients who come in with mental health problems, and sometimes that they can be aggressive, and that pretty much happens at least once a shift. But there are certain security measures in place, and I've never felt threatened, but it definitely can be scary if you, and I have to go through like certain training of how to de-escalate certain situations, but you know, with that proper training, I feel capable of handling it when it arises.
That's great. Okay. Kelsey, I have a question for you, and this one is kind of open-ended, so I don't know how long-winded you're feeling today, but what is something you wish you knew before graduating from college?
Ooh, that's definitely, there's a lot I could do with that. I would say the biggest thing really is just how having access to such a, you know, variety of experts in different topics, and, you know, really just like the wealth of information that's available. You know, not that I necessarily like took that for granted, but I guess I didn't quite realize that that doesn't really happen, you know, again, and that even, you know, working in a professional setting, you have to work just to get information and, you know, figure out who is the right person that I need to talk to get that information. And there isn't necessarily like a roadmap to help you figure out, oh, I need to know X, Y, Z. That means I have to go talk to so-and-so. You kind of have to navigate a lot of that on your own. And I think that, you know, in the college environment, you have a lot more help with that, which is something that I wish I tapped into a little bit more while I had that opportunity. You know, if I had known that I wasn't going to have that again, would have done some things differently.
That's a great answer. Yeah, I mean, working it as an administrator in a college, I definitely, you know, see a lot of that. You know, I always try to tell my students, you know, take advantage of this because these things aren't going to be at your disposal. But yeah, that's very interesting. So Kelsey, walk us through a day in your life, in your career.
It really depends. It depends on the day, and it depends on whatever particular projects I'm working on at that point in time, which, you know, can be a wide variety of things. But whatever I'm doing, in most cases, I really try and actually go to the environment where the people are working, you know, in part just to get a better understanding of like the physical layout and, you know, all the steps in the process of whatever it is we're working on, but also just to show, you know, my interest and like willingness to really learn about what it is that they do, what challenges that they have, so that way I can do the best that I can to help them, you know, either solve those problems or make them less painful. So that typically gets to be interesting in terms of, you know, going to different places, seeing different things. You know, I've gotten to see all of our laboratories, our different sterile processing areas, different ORs and things like that. So really just seeing, you know, how much is entailed in a hospital, and how much goes into not just, you know, setting it up, but also staffing it, making sure that there's adequate coverage everywhere, which is kind of impossible in this current labor market. But, you know, I try and get out there as much as possible. I don't want to be somebody who just kind of sits behind a desk and, you know, does emails all day. That's definitely involved, but I try not to make that be the majority of my day because I would not enjoy that personally.
That's great. So a question for all of you sort of at large here. Can you recall a course, like, whether it was a gen ed or like some free elective that you felt was helpful or like just a lot of fun? Or any class you really disliked? Why, I mean, why not? We can go there. Just and any sort of memory that you have, whether it's the course or the professor that you felt like this was really time well spent or not. Any sort of anecdotal things to share with us on that level? Anyway, yeah, I mean, if anybody has anything to say.
Yeah, I
My,
can go.
yeah.
Oh, sorry.
Oh, yeah.
Was someone else going to speak or?
No, I'm rambling on. Don't worry about me.
Oh, no, you're good. Sorry, I have a lag on my end, so I just wanted to make sure I wasn't cutting anyone off.
No.
I guess there are a lot of things. I feel like I wasn't there too long ago, so I do remember a lot. I think Dr. Greeny in particular, and I'm not sucking up because she's not here, but she was really, really helpful to me. I think I went to her a lot to ask about, different paths that I could take with my MPH, different people to talk to. I like made sure that I asked her for like a lot of people's emails and kind of just information to explore what paths I was taking. And I think it was HLT 450 was like the last class that I had to take that we did a lot of like, sorry if I'm not remembering this wrong, but like a lot more of the applied public health things. And that kind of gave me the broader view of all of my options. So I think that was really helpful in some ways, just because I really didn't know at that time where I was going to go. So it at least helped me figure out a map of what directions I could take. And my least favorite class that like stands out to me probably was chemistry, which I think was just as valuable to me. And I would say this about any experience you have, whether you're going out to grad school, if you're doing other internships, other jobs, it was, if not as important, more important to know what I didn't like compared to what I did like. So I knew I always loved science, like in high school and college and everything. Chemistry kicked my butt, and I was like, okay, lab science is not for me. So at the time I thought I wanted to be a doctor at some point and go on to medical school. And I was like, this is going to involve a lot more of the hard sciences. I'd rather go kind of the more intermediate route where I'm still working with science and data, but I also have like people and I'm not taking the biochem classes and things like that. So yeah, that really stood out.
Very good. Anyone else have any anecdotal info to offer up? No. How about, do you ever feel like there was anything you would do differently? Like would you have chosen the major you chose, or like would you have minored in this or not minored in that, or anything like that when you think back on your own academic path? Or is everybody pretty much happy with what they chose and felt it was a good fit?
I think this probably gets it, this question and the last one. But really what I enjoyed and found to be really advantageous is just the nature of the health studies program at large, being able to take so many different classes in a variety of different subjects and not have any of them necessarily be, wasted, because you have so many different electives to fill. So really just like taking advantage of that and taking different classes, a class that you might not have pictured yourself taking, or that might not necessarily fit with the whole like health studies program, A, because you can, and B, because that's something I found to be beneficial going into grad school, and even, now in my career, just knowing that I took so many different classes, and, I might have only skimmed the surface of it, but I at least had some sort of, recollection of that topic. So definitely taking advantage of that. I had minored in business and in leadership studies, which, I definitely would not have been able to do if I didn't have that flexibility with all of those elective credits.
Cool. Just a student comment here, NRS 326X is a really good leadership and public speaking class. Just wanted to point that out, comment from a student. So,
I just jump
yeah.
in to say that I definitely have had thoughts of like, oh, why didn't I start off as a nurse in undergrad right away? But I totally loved my undergrad degree with health studies. And I feel like it has really helped me have like a much more broad and bigger picture of the healthcare system, not starting directly off as a nurse. I feel like I'm able to look at it from the big picture, from the stuff that I learned in undergrad, mainly, I would also say in those HLT courses. And then, but I can now also scale it down just to like an individual patient. And I like being able to look at healthcare from both points of view. And also on top of that, when I was an undergrad, I was fortunate enough to be able to study abroad. And I did a semester in South Africa where I did a ton of outreach stuff with HIV and AIDS. And I totally loved that. Like that for me was like the moment when I was like, I really enjoy like working with patients and doing healthcare related stuff. So, and I don't think I would have gotten that opportunity. I mean, I'm not sure, honestly. I don't know how like rigorous the nursing curriculum is when you go straight from undergrad, like through URI, but I don't know, like for me personally, if I would have been able to do a semester abroad in a nursing program. So I'm really happy that I kind of veered off in those different directions, if that makes sense.
Yeah, that's a great point. Yeah, thank you, Maya. Great. So I wanted to turn it over to the students now to see if you had any questions, and you can, if you'd like to speak out a question, you want to unmute yourself, or if you'd like to type it in the chat, whatever you feel comfortable with. I'd love you to, ask anything that might be on your mind concerning our panelists and their careers. If there's any chat here. Anybody have any questions or any thoughts or comments they wanted to give to our panelists?
I had a question for Kelsey.
Yeah.
I was just wondering, when she was doing policy analytics at GW, were there times you thought about entering a government side to healthcare, and was seeing like the policy change in DC on the delivery of healthcare eye-opening? And do you use that for your current position a lot at Hartford?
What was that question for? You cut out at the beginning.
Oh, really? Sorry. So when you were doing policy analytics for GW, were there times that you thought about entering like a government side to healthcare, and was seeing the effects of the policy change on healthcare in DC eye-opening? And do you use a lot of the stuff that you learned for your current position at Hartford?
Oh, I do. But being in DC, living there for 2 years, it was enough to make me not want to get into the politics side of it. It was definitely great to see it and to learn about it. But just working in that kind of environment was definitely not for me. But having access to, those people who are leading policy changes and things like that, it was a great learning experience for sure. A lot of the policy analysis that I did was actually based on hospital operations in terms of what are the best practices for hospitals, particularly safety net hospitals in other parts of the country, that helps them to be financially viable. And in DC, the landscape there, it's broken out into several different wards, and a couple wards, 2 of them in particular, have, much worse health outcomes than the others. And it was because, it's a food desert, it's a healthcare desert. They didn't have a hospital there. So that's why when they were looking to build a hospital there, they wanted this policy analysis work done to say, well, knowing, how challenging the financial situation is going to be, what does this hospital really need to be able to do well to stay open, and be able to serve the community. So it was a really great kind of mix of the policy work and being able to apply what I learned there, but still being focused on kind of operations and what needs to happen day to day to keep the doors open kind of thing.
All right, perfect. Thank you.
Thanks so much. We have another question for Heidi, from Linda. Linda, are you there? Do you want to speak into the mic?
Yeah, I'm here. Hi,
Okay.
my name is Linda. I'm a senior and I'm a triple major in health studies, computer science, and data science. And I recently had a coffee chat with one of the public health epidemiologists in the RI health department. Her name's Rachel. She also went to Brown for MPH. And one question that I asked her was, what advice would you give students that are trying to get into epi?
Yeah, that's great. And hi, Linda. That's so funny. I wonder if I know Rachel. There are a lot of MPHs from Brown that are working at Rido right now. So, so you said, sorry, what was your question? Something about getting into epi? I lost my train of thought.
What advice would you give students trying to get into epi?
Yeah, I think if you know what type of epi you want to do. So if you want to work in, like I specifically wanted to work either for like a nonprofit or for the government, but there are also epis who do field work. There are epis who do, like they work for private companies. So like Blue Cross Blue Shield has epis and things like that. And data analysts, I think, start looking into those types of jobs and start reading job descriptions and pay attention to what kind of analysis skills they want you to have. So one of the things that kind of got me stuck when I first graduated from graduate school is that I took all of my classes learning R. And R is free to learn and open source, and there's a lot of great resources for it. And it's kind of thought to be harder than the other programming languages for EPIs. But then when I started applying for jobs, almost everyone was looking for SaaS experience. And I think that might have been because I was looking at like local health departments and things like that. That's just what they use. And I had learned a little bit of SaaS in grad school, but definitely wasn't my strongest skill. So I really had to brush up on that before I started really like going and heavy and applying. So really, I guess, paying attention to what languages they're using and I guess like what their day-to-day looks like. So I know if you go into biostatistics, it's very similar, but it's much more data heavy and not as much of that balance of like communication, human interaction, like collaboration, I guess, with other teams like I have the experience with, which I don't. They do have biostatisticians at Rido. There just aren't as many. So I guess those are the two main things.
Thank you. Actually, I'm going to follow along with that. So I'm actually coding in R as well. How much R and SAS coding do you do? Is it mainly R or just SAS?
I do 0 R coding at Rido. Doesn't mean that you can't, but it makes it really handy because I work in the Center for Health Data Analysis. So it's like all of the EPIs kind of together. Some of them are split off in different programs. But it makes it a lot easier for like data sharing and like collaborating on projects if you're all just kind of doing it in the same code. You can still use R if you want to. I just think it makes it a little bit harder. And as far as like time spent, it really depends on what projects I'm working on, but I'd say probably 50, if not like 50%, 70% of my job is coding in SAS. So that was kind of a surprise for me, but it's definitely easier to pick up if you're already coding in R all the time. So
Great. Thank you so much, Heidi.
Thank you, Heidi. Good job. Okay. So looks like we have all the questions answered. Anybody else have any last minute questions? No? Okay. Well, I want to sincerely thank all of our wonderful panelists. They provided so much information, so much insight into their careers, their day-to-day lives. We just thank you so much. These sessions are just so invaluable for our students, and we really appreciate you giving back to the to the population here, coming back to your alma mater and letting us know what life is like. And we're just so happy to have you. So I just want to thank you so much on behalf of URI, on behalf of the College of Health Sciences for being here today. And I hope everybody has a wonderful day, wonderful, beautiful weather day tomorrow. And I hope you really enjoy your weekend. Thank you, everyone.
Thank you.
All right, thank you.
Thank you.